Good afternoon. November 30th, 2006, at 6:05 in the morning, my sisters and I would lose one of our very best friends and our dear mother to a long, courageous 7-year battle with breast cancer. One of my mom's dying wishes was that neither of her children nor their families ever had to endure what she went through over the course of that 7 years. In 2009, both of my sisters became aware of a breast cancer testing that could be performed. They both had the testing performed, both subsequently tested positive for what was known as BRCA2, and within 1.5 months of each other, opted to have bilateral prophylactic mastectomies and subsequent reconstructive surgery performed. This brave and bold decision assured that neither of them would ever contract breast cancer or suffer the same fate as our dear mother did. Today I'm going to attempt to convince you of the reasons why to get genetically tested for breast cancer if you qualify to do so, or at the very least to encourage you to support a friend or loved one who is at risk. My hope is that the information I share with you today may help to save either your life or the life of someone you love. Specifically, I'm going to define the BRCA gene test for you. I'm then going to provide you with some well-chosen facts and statistics about the test. Thirdly, I'm going to tell you how you would know if you or someone you love is a candidate for the BRCA breast cancer gene test. And finally, I'm going to explain the benefits to you of being tested and options you have should you test positive. The BRCA gene testing defined according to the Center for Restorative Breast Surgery is as follows. The BRCA gene test is a blood test that uses DNA analysis to identify harmful changes, also known as mutations, in either one or both of the breast cancer susceptibility genes known as BRCA1 and BRCA2. Women who have inherited mutations in either of these genes face a much higher risk of developing breast cancer and ovarian cancer compared to the general population. The BRCA gene test is offered only to people who are likely to have an inherited mutation based on personal or family history, or who have specific types of breast cancer. The BRCA gene test isn't routinely performed on women at average risk of breast cancer or ovarian cancers. So this is only offered specifically to people with the criteria that I will go over in just a moment. Some facts and statistics according to the National Cancer Institute. In 1994, the first gene associated with breast cancer was identified, known as BRCA1, which stands for breast cancer 1, when it was found on chromosome number 17. 1 year later, a second gene associated with breast cancer was discovered on chromosome 13, known as BRCA2, or breast cancer 2. 1 in 8 women in the United States will develop breast cancer in their lifetime. For many of them, the cancer is too far advanced in its stages, such as our mother's was, unfortunately, and there's no turning back. The general population of American women has an 8% chance of developing breast cancer in their lifetime. That's general population. Women who tested positive for the BRCA mutation have a 56 to 87% chance of developing breast cancer in their lifetime. Astronomically larger than the 1 in 8 or 8% of the general population. The general population of American males have a 0.5% chance of developing breast cancer in their lifetime, whereas men who test positive for the BRCA mutation, either 1 or 2, have a 6% chance of developing breast cancer in their lifetime. Children of parents with a BRCA mutation have a 50% chance of developing the gene mutation as well, which is huge. That's 1 in 2. Am I a candidate for the BRCA gene testing? Well, according to the Mayo Clinic, if you have had breast cancer at a very young age, also known as premenopausal, you are a candidate. If you have family history of breast cancer at a young age in 2 or more close relatives, either parents or siblings, you're a candidate. If you have a family history of breast cancer in more than 1 generation, you're a candidate. If you have had a male relative with breast cancer, since the general population for males is so slim, you're a candidate automatically. If you have a frequent or have had a frequent occurrence of ovarian cancer in your family, you're a candidate. If you have either a positive BRCA1 or BRCA2 test in a relative, you're a candidate. And finally, if you're of Eastern European Jewish ancestry, with or without a family history of breast cancer, which this type of person is 10 times more likely to have a BRCA1 or 2 mutation than general population, you are a candidate. So now I'd like to discuss some benefits of testing and options if you test positive for gene mutation. According to the Hereditary Breast and Ovarian Cancer Syndrome Patient Guide to Risk Assessment. This is the risk assessment guide that both of my sisters received when they first went in to obtain their blood tests for the breast cancer testing. First and foremost, you have choices. You have choices to be proactive in general. That's something that you won't know about or you won't know how to act upon if you aren't aware that you have this mutation, which significantly increases your risk for breast cancer. It provides you with increased surveillance. If you find out that you test positive for BRCA1 or BRCA2, you receive clinical breast exams every 6 months and an MRI exam every year starting at age 25. Early detection is key. You also receive a drug called tamoxifen. This is a chemopreventative that could reduce the risk of developing breast cancer by 50% for women with increased risk of the disease. So if you just have the knowledge, if you have the simple blood test done and have the knowledge that you have this mutation, either 1 or 2, and you start taking this chemopreventative tamoxifen, you automatically your chances go from 56 to 87% that you are going to contract breast cancer in your lifetime, down to cutting it 50% of that. So down into 20-some%, 20 to 30%, which is huge. You could undergo preventative surgery, just as my sisters both did. This prophylactic mastectomy is the surgical removal of healthy breast tissue that reduces breast cancer risk by 99%. And now wait, the best part about it is no out-of-pocket costs. Over 95% of all patients' health insurance cover 100% of all costs related to both your surgery, your removal of your breast tissue, as well as reconstructive and follow-ups, if you have tested positive for BRCA1 or 2. Doesn't get any better than that. And finally, you can change your lifestyle. Alcohol, obesity, obesity, high dietary fat intake, and lack of exercise have all been shown to increase breast cancer risks. These are all lifestyle changes that you can make. You can modify, you can cut down on your alcohol intake or abstain from it completely. You can change your diet to cut out high fat intake. You can start exercising. All things to help you if you have the knowledge that you are a carrier of either BRCA1 or BRCA2 gene mutation. In conclusion, I believe 100% that if my mom would have had the knowledge, the information that I'm sharing with you today, that she would still be here with us. She would still be here as the mother that my sisters and I loved so much and missed so dearly, going on 5 years of her being gone now. And my sons, my 2 boys, Jake and Ben, who are only 6 and 4, wouldn't have been robbed of the most wonderful, unconditional love that would have been provided to them by their Grandma Patty. Tonight I defined the BRCA testing for you. Then I provided you with facts and statistics. Thirdly, I informed you of who qualifies as a candidate for breast cancer testing. And finally, I discussed some benefits and options an individual has should they test positive for the gene mutation. Again, 1 in 8 women will be stricken with breast cancer in their lifetime. If you happen to be carrying the breast mutation, your chances are 1 in 2. 1 in 2, or even greater. Don't let this terrible life killer rob you and your family of precious moments and memories with someone loved so deeply the way it has my family. If you or someone you know is a candidate for BRCA gene testing, please take action today before it's too late. Thank you very much for your time.